A very good afternoon and warm welcome to all our viewers. On behalf of Human Biological Institute and Fearless Against Rabies. Fearless Against Rabies is an initiative by Human Biological Institute to educate about rabies and to reduce the incidence of disease. It is my pleasure to take this opportunity and share about Human Biological Institute. Human Biologicals Institute, a division of Indian Immunological Limited, shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by the National Dairy Development Board (NDDB) in 1982 as its unit, and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute has established in the year 1998 when the Government of India requested Indian Immunologicals Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facility at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. As a market leader, we have taken a significant step to reduce the plastic burden by 160 ton per annum. And we are very proud of our green initiative. While coming to our corporate social responsibility, we have done the adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. Over 1,600 school-going children from Telangana and Tamil Nadu are benefit. Another responsibility, Indian Immunological Limited has donated oxygen generation plant to Telangana Institute of Medical Sciences, Gachibowli. The plant is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indieimmune.com. You can also contact us on our toll-free number 1800-313-999977. You can also visit us in our initiative www.fearlessagainstrabies.com and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today on Fearless Against Rabies platform. Human Biological Institute is celebrating World Immunization Week, which is an annual global public health campaign that aims to raise awareness about the importance of vaccine in protecting people from preventable disease. Well, in today's session, we are going to learn about the topic why vaccination is important against animal bite. Vaccination is important against rabies because it can prevent the disease from developing in individual who has been exposed to virus. To enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Prakash Doshi. Dr. Prakash Doshi is a medical professional. He has been running a private hospital since 1985. He's also a member of APCRI since 15 years. He has handled nearly 10 CME sessions related to rabies management. In addition to his clinical practice, Dr. Prakash Doshi has been managing an anti-rabies center for more than 20 years. He has also published articles on rabies management in local and medical magazines. A very warm welcome, Dr. Prakash Doshi, sir, on Fearless Against Rabies platform.
Yeah, thank you, madam. Most welcome, and thanks for the viewers.
Thank you, Doctor. Doctor, while we start our discussion for today, I would request you to kindly explain our viewers in simple terms that what rabies is and what and how it can be transmitted to humans.
Yeah, wait, madam. Rabies is 100% vaccine preventable disease, mainly affected by the rhabdovirus group, more the animal bites who are carrying the rabies virus. Rabies is a disease 100% fatal, yet it is 100% preventable also. So vaccination of the dog, it prevents from the rabies 100%.
Uh, Thank you, doctor. Many a time, individuals don't know that what they should do when they have been bitten by an animal which is suspected of having rabies. So, at that time, how can they obtain the necessary treatment and vaccination?
Madam, animal bites. Majority of the dogs, cat, monkey, horse, mongoose, camel, wild mammals. After biting this, there are enough chances whether or not rabbit. But we should consider as a rabbit, and we should go for the primary management. Important is the wound hygiene. We have to with the tap water for 10 to 15 minutes. Then one should approach the doctor and go for. In our next question, we'll see there are some three categories of the bite. That is category 1, category 3. It is classified by the WHO, World Health Organization. So, as per the protocol, animal bite, one should not neglect or ignore the because if the animal chances of death are nearly 100%. So, it should be always clinic and consult the doctor of the nearest center. Yeah.
Thank you so much, doctor. Uh, Doctor, so what vaccines are currently available?
Yeah. Uh, Animal bite. Mainly, first primary, one should take the tetanus as a prophylaxis vaccines. Anti-rabies vaccines are X cell, virocell, as well as cell culture. 3 or 4 types of vaccines are available in our routine. It is Abhay clinic. We are using anti-rabies Abhay mainly.
Uh,
Immunoglobulins required there. We are to give the immunoglobulins, human or equine. But main of the any available type, 4 or 5 leading brands are available. One should go for that. 0, 3, 7, 14, and 28. Usually 5 doses are sufficient to take for the 100% prevention or the prophylaxis.
so the recommended vaccination is for five.
Yeah. Uh, it's, if you can observe the animal, supposing one dog bite you, if you can observe more than 14 days or 10 days, usually rabid animals are not surviving more than 2 weeks. Schedule is 0, 3, 7, 14, 28. 0 means bite day of bite, but the first vaccine you have taken. Supposing today the dog bite you, you take first vaccine, so it should be 0 on the third day. So 0, 3, 14, 3, 7, 14, 28. If the animal or dog is survive more than 10 or 15 days, the dose is 2 doses, you cannot take it. Yeah.
Okay, thank you, doctor. So, doctor, what are the types of what we can say as the categories of animal bites? So, can you
Yeah,
please elaborate on the categories?
sure. It's the victims as well as doctor also. World Health Organization has divided cases in 3 categories: category 1, category 2, and category 3. very on the tips of the hand or on the genitals or the neck or the some there. On that base, the category was there, but since last few decades, did category 1, category 2, category 3. So in category 1, only leaks over the skin means that is fresh skin. There should be not wound on the skin. So dog just licks on your hand or face, but there is no problem. Only scratch, minor scratch is there. No blood is there. Leaks on. In these cases, you need not to do anything. You just clean the part with the soap water. No need of any vaccination or no need of any immunoglobulins. Category 2, it cuts with the dog teeth or even the नाखून से भी कभी-कभी scratch हो जाते हैं. मगर one thing is very sure, there should be no there. So then you have to take only vaccination. You need to take the rabies immunoglobulin as per the schedule 037 1428. Here in this case, no need of globulin. But there is a one test is there. It's known as the spirit test. It's a local spirit or ethyl alcohol. You have to apply over the wound. If there is a tingling or but it shows it has the bite is little bit deep and it touches the nose. You should go for the vaccines as well as immunoglobulins both. But in simple scratch, where no category 1, category 2, and only you should take the anti-rabies vaccination. Category 3. In category 3, it's a multiple bite, deep bite, or in our practice, we see usually 70 to 80% cases are category 3 only. Bite, deep bites where blooding is there. This is category 3 bite, and as per the WHO guidelines, you should take the anti-rabies vaccine as well as anti-rabies vaccine is a vaccine is an injection we give on the day 5 or 7 days or 10 days the antibodies will produce, while in antibodies and immunoglobulins you have to give at the site of bite. मतलब bite किया है उसी जगह उसको देना होता है और of mainly 2 types. It is human immunoglobulins as well as equine immunoglobulins. From the horses. Horse को इंजेक्शन देके उसके जो एंटीबॉडीज है उसको इक्वाइन फॉर्म में आता है. इक्वाइन का यूजुअल डोज 40 मिलीग्राम पर केजी बॉडी वेट होता है. इट इज अ रीजनेबल कॉस्ट नहीं है, बट उसमें यू टू गिव टेस्ट डोज करके देना होता है. और बड़े 6 के कुछ प्रोटेक्शन इंजेक्शन ऑक्सीजन और फैसिलिटी ह्यूमन इट इज लिटिल कॉस्टली. 20 मिलीग्राम पर आयु केजी बॉडी वेट देने होते हैं. immunoglobulins you have to give immediately, possibly earliest. 6-7 दिन के अंदर दे देने चाहिए. उसके बाद में एक बार एंटी रेबीज वैक्सीन के जो एंटीबॉडी क्लियर हो जाते, बट आई एम श्योर कि इम्यूनोग्लोबुलिन्स आर लाइफ सेविंग. वैक्सीन की इफेक्ट होने में 8-10 दिन लगते हैं. दिस स्पॉट वायरस को न्यूट्रलाइज करते हैं और उसको स्पाइनल कॉर्ड या तो नर्व. सो ऑलवेज इन 3 categories. Most of the cases we are facing in immunoglobulins, और immunoglobulin एक ही बार देना होता है, once only. और कुछ फायदे ऐसे भी है, बाइट होता है तो immunoglobulins की फिर जरूरत नहीं पड़ती है अगर पूरा डोज दे दिया है. Okay, मैडम. This is 3 categories of bite divided by the WHO as classified.
Thank you, sir, for answering this question about the categories of animal bite, as well as telling the audience about that what is what is anti-rabies immunoglobulin as well. Thank you, doctor. So, doctor, what should be the management of re-exposure to be approached in individuals who have already been vaccinated?
Before giving your answer, just I would like to clear one thing. After dog bite, the wound hygienic या तो wound toileting, it is very very important, because or before reaching to the hospital, sometimes 2 or 3 hours are passing. So at home also वुंड को अच्छी तरह वॉश करना है डिटर्जेंट से, साबुन से. वुंड क्लीनिंग इज वेरी इंपॉर्टेंट. इम्यूनोग्लोबुलिन्स, एंटी रेबीज वैक्सीन का वुंड टॉयलेटिंग और वुंड क्लीनिंग का इंपॉर्टेंस है. तो बिफोर रीचिंग टू द हॉस्पिटल थोड़ा टाइम है, तो वुंड क्लीनिंग इज वेरी, थोड़ा मोर एम्फेसिस करूंगा. रिमेनिंग टू द क्वेश्चंस, सपोजिंग यू आर हैविंग एनिमल बाइट, यू हैव टेकन द ऑल डोजेस फॉर अप टू 6 मंथ. अगर रीबाइट होता है, आपको कुछ लेने की जरूरत नहीं है. You can ignore it. But if it is more than 62 doses, that is 0 and 7, at least minimum up to 2 years. और sometimes body tighter होता है, वो भी आप चेक करवा सकते हैं, बराबर. पर यूजुअली अप टू 2 to 3 years कभी भी होता है. to take the immunoglobulins, and you can take only 0 and 7, only 2 doses.
Okay. Thank you. Yes, doctor. Thank you. Thank you so much, doctor.
Yeah.
Doctor, thank you once again for giving us a lot of information on today's topic. It's time to take some questions from our viewers, doctor.
Yeah.
Doctor, the first question is, if someone has been previously vaccinated against rabies, do they still need to receive treatment if they are bitten by animal that may have rabies?
If the rebite of the animal is confirmed rabies, sure. It's only, I think, previously he has taken 5 doses and immunoglobulins. They have to take only 2 doses, that is 0 and 7 only.
0 and 7.
Yeah. Meanwhile, I would like to emphasize one more thing. Usually we are giving intramuscular injections, mainly on deltoid, or in kids it's upper and anterolateral part of the thigh. But never one should give the injection, one should give or one should take injection over the buttocks, or the, because due to lots of fat inside that, the absorption of the rabies vaccine will be nearly 20% part will not benefited. उसका benefit नहीं मिलता है. So either if take or upper outer part of the thigh in the kids, and in big hospitals or big intradermal dose also. Intradermal, supposing in intramuscular doses, we are giving points on the shoulders. But where the big hospitals are there, in some states, vaccines are not available, cost factor is there. So intradermal is both the delta, they are giving 1 ml only. 1 ml means एक बूंद जितना वैक्सीन देना होता है दोनों शोल्डर पे, और शेड्यूल इज 037, उसमें 5 से 3 डोज होते हैं. तो इट इज बेनिफिशियल, लेस इफेक्ट, painful and economic. Some limitations, once you dilute the vial, you have to use within 6 hours only. एक बार जो डोज बनता है उनमें से you have to use within 6 hours. So this injections or practice is available, mainly used by the big hospitals, but it has even better efficacy also. So,
thank you, doctor, for answering this question for audience. There's one more question. What are the some steps that people can take to prevent animal bites?
first of all, प्रोफाइलेटिक वैक्सीनेशन भी होता है.
Okay.
मान लो जब जैसे बच्चों को, आई थिंक वेरी shortly within 2 or 3, cover the anti rabies in the vaccine. जैसे हम ट्रिपल पोलियो, MMR, हेपेटाइटिस बी, हिप सब देते हैं ना, ऐसे गवर्नमेंट विल इंक्लूड द anti rabies vaccine in the, usually suppose if they take the 0 and 3 or 0 and 7 dose as a profile animal handlers, some persons who are working in the rabies research laboratory or some zoo, those chances of exposure to the animals, they are taking the prophylactic doses, that is the 7. It is a
Okay.
Prophylactic vaccination schedule. So after supposing dog bite will be there, so in any case you need not to take the immunoglobulins. Immunoglobulin in human, reasonably human are very costly, so you are out of that, and it will chances of risk is almost minimized, nearly zero. Who they are taking? Usually, those who are working in the laboratory, the research lab for the rabies, animal handlers, या तो veterinary doctors. Definitely, it is having very big benefits. No need to take the immunoglobulins, and every 2 years they can go if they need the vaccination. So if it is more than 15, they need not to take it repeatedly. Rather. Okay.
Thank you, doctor. Doctor, what we can say? There's another question he's asking, that what would be the possible side effects of rabies vaccine?
Then is usually having least side effects. Sometimes local pain is there. Usually they are disposable needles. They are disposable needle and series vaccine only. So there are chances of infection in my practice since last 20 years. I have seen, but if the patients are sensitive, so sometime after giving the vaccination, some vasovagal shock is there, but it's of the severity. It's very mild. The only thing in the immunoglobulins in equine, there are some chances of anaphylaxis, some local reactions. We are giving negative test dose. We wait for some time, and then we are giving. Practice of 2 decades, I have not seen any major side effect of the vaccines or serum.
Okay. Thank you, doctor. There's another question, that how effective is the vaccine against rabies?
I would mention, okay, it is 100% preventable disease by vaccine in time, immediately after the dog bite or the animal bite or the rabbit vaccines. Then in as a whole, in vaccination as a whole means of the any disease, diphtheria, tetanus, BG, or B, hepatitis A, they say it's effective by 80 to 90%. Any vaccine, the typhoid vaccine, there are some chances that I may expose to the typhoid after 3 or 4 months. Likewise, that vaccinations are having some limitations with the patient's body response, also patient immunological condition also. But I think if taken in proper time and wherever necessary immunoglobulins are taken in time and vaccination are full doses taken, I can say it is 99 to 100% is there.
Okay. Thank you, doctor. Doctor, another question is, how long does the rabies vaccine protect me from the virus?
Yeah. The incubation period for the dog bite, it starts from 40 weeks to even sometimes 10 to 12 years also. Incubation, once you have taken the full doses, then I'm sure कि 2 से 3 साल लेवल जो उसका मिनिमम ब्लड में इफेक्ट होना चाहिए, फिर ग्रेजुअली उसकी इफेक्ट डाउन हो जाती है. तो अब आफ्टर 2 to 3 years अगेन एटलीस्ट ब्लड टाइटर भी आप करा सकते हैं, और या तो फिर आफ्टर टू द फुल डोजेस. मगर मिनिमम वंस आई हैव टेकन you have taken full doses up to 2 to 3 years safe for the any animal bite.
Oh, thank you, doctor. There's one more question. Can I get a rabies vaccine if I am pregnant or breastfeeding?
रेबीज वैक्सीन में मैडम न्यूबॉर्न से लेके एनी प्रेग्नेंट लेडी वन शुड गो एज इट इज 100% फेटल. प्रेग्नेंट लेडी और फर्स्ट और सेकंड और थर्ड ट्राइमेस्टर किसी भी फेज में अगर डॉग बाइट होता है, रेगुलर वैक्सीनेशन definitely it will not hurt to the baby, but as the disease is 100% fatal.
Oh, thank you, doctor. There's this last question. Is there any difference in dosage when it comes to age group for vaccination?
No, madam. As the WHO guideline से लेके 90 साल 90 years 90 for the any age group, male female same. Some companies dose is 0.5 ml and some are having 1 ml, but same. So one should go for the regular doses at any age. No bar major minor changes in the age group. For any age group, same dose, same vials are available.
Thank you, doctor, for answering all the questions for our viewers. Doctor, in the end, I would want to ask you that what is the most crucial information about the rabies disease that you want general public should be aware of?
Mainly in my practice, madam, I am in practice since 35 years. We saw patients are coming with लाल मिर्ची लगाते हैं, छिकड़ी लगाते हैं, कोई कोइन लगाते हैं, कोई कोल means after bite people are putting some unauthorized or लगाते हैं, means lime लगाते हैं. So this should be avoided. It will infect the wound. So only wound hygienic is very important. After cleaning the wound, put the antiseptic and go to the doctors. Wound is very big, bleeding, or very deep, or cosmetically face cases. Usually, doctor give the immunoglobulins and they can take the loose or the minimum sutures in some special cases only. One more thing that there are lots of patients in the society, those who are having AIDS होता है, इम्यूनो कोई चलता है, कैंसर की कीमोथेरापी लेते हैं, लीवर ट्रांसप्लांट, कॉर्निया ट्रांसप्लांट, ये सब होता है. पेशेंट्स की इम्यूनिटी बहुत कम हो जाती है और दे आर ऑलवेज ऑन द इम्यून केसेस. जो लंबी बीमारी वाले केस है, या तो जेरियाट्रिक एज ग्रुप में है या तो पे चल रहे हैं, उनको वी शुड गिव द डबल डोज. उनकी इम्यूनिटी कम होती है, इसलिए कि उसकी जगह दे नीड टू टेक द 2 डोजेज ऑन बोथ द डेल्टास. बोथ द डेल्टा पे देना होता है, तो उसका बट wound cleaning are life saving, or it is must for any person who come across the bite of death.
Thank you so much, doctor, for sharing this most important and crucial information with the viewers. Well, it was a very wonderful session, doctor. We wholeheartedly thank you, doctor, on behalf of my team as well as Human Biological Institute, uh, for sharing your valuable time with us. Yes, doctor.
No, okay, madam. So I would like to add only one thing.
Yes, doctor.
Rabies RABIES. So take home message. R मतलब or the vaccination center immediately. R after any animal bites. Right? Second, antibodies. Third is bite to look after the category 1 bite, category 2 or category 3, and take the simple cleaning or vaccination with rabies immunoglobulins, either human. I means intradermal or intramuscular injection of the rabies, anti-rabies or intradermal. Same thing at the possibly earliest and as per the standard protocol 037 1420 means every person of the animal bites should take the proper treatment. And S means stress. If you follow the RBI, then and you are free for the post-exposure prophylaxis.
Thank you, doctor. Thank you so much. Thank you. It was a very wonderful session, and I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thanks our viewers as well for being with us in each and every session. You can all follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on live talk with expert doctors across the nation. With that,
Sure.
Thank you, doctor. With that, I wish everyone a very good afternoon. Thank you
Yeah.
once again, doctor. Thank you.
Still, madam, any question you find, you can forward to me. I will reply.
Sure, doctor. Sure. Thank you so much,
Thanks.
doctor.
Thanks a lot. Okay.
Thank